Hi, welcome to Case of the Day. Today is the third case and it's titled PTLD and Query Reactivation. So I reported this case today. A 42-year-old detected to have cavitary lung lesions on a CT neck done for an unrelated indication. This was about 3 weeks ago. And she had a history of treated lung TB in 2004 and TB pleural effusion in 2021. So came for a CT chest yesterday, and we can see these clear signs of architectural distortion, post-infectious traction bronchiectasis, fibrocalcific and fibronodular lesions with significant volume loss. Um, in the superior segment, which shows compensatory overinflation, we have cavitary nodules, we have these clustered centrilobular nodules and opacities, popularly called tree in bud at the periphery. And then again, we have some post-infectious changes here. There's a diffuse pleural thickening, likely from the episode of pleural effusion. There's contracture of the hemithorax, and there is this complete atelectasis of the lingula with calcification, with probably endobronchial stenosis of the lingular bronchus. So a whole bunch of findings. But there are definite findings of old TB, which now we call post-tuberculosis lung disease or PTLD. So we've just started using the term. Otherwise, we would just say post-infectious changes. And I think everyone who reads TB scans should read this article from 2021. It's free to download, and it has this table that describes all the different changes that can occur with past tuberculosis or a part of PTLD. So it's just a good idea to use this term. Now, the patient also has these cavitary nodules, areas of tree and bud. And the question that arises is, are these just part of the old TB or do they represent reactivation of TB, especially when we don't have any old scans to compare with? And our job as radiologists, therefore, is to describe the background changes of PTLD and then flag the areas of concern. So, in the remarks, we should say that there are definite findings of PTLD, but there are areas of cavitary nodules and infectious bronchiolitis that are worrisome for the possibility of reactivation and should be further investigated. And then the physician can decide clinically whether it's worth going ahead, and if so, what are the methods they would use to further investigate. That's my WhatsApp channel, and that's the case of the day today. Thank you for viewing it.